Good afternoon, everyone. On behalf of NASH 24 by 7, I welcome you to our public awareness program on current management of NASH and NAFLD. NASH 24 by 7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have renowned gastroenterologist from Mumbai, Dr. Nikhil Patil, sir. He needs no introduction. However, I would fail my duty if I don't mention that Dr. Nikhil Patil is a leading gastroenterologist in Mumbai, providing the comprehensive care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Jeevan Clinic Mumbai as a senior consultant gastroenterologist. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Nikhil Patil, sir, to enlighten us on the topic. Over to you, sir.
Okay, so good afternoon, viewers. I would like to just tell you initially that every year June 13th is celebrated as Global Fatty Liver Day. Okay, so the theme for this year is Act Now and Screen Today. So basically, by this theme, we are trying to focus on evaluation on detection of fatty liver, because almost worldwide 115 million individuals are involved with fatty liver, and by 2030 it is expected that 357 million people all over the world will be affected by specifically fatty liver. So today's topic is very important from every perspective, so that we detect the disease early and prevent the complications from happening. Okay, next slide. So we will start with initially a small topic about the liver. The liver is second largest organ of human body. It is weighing up to 1.5 kilos with approximately 5% of the fat. It is located in the right upper quadrant of the abdominal cavity on top of the stomach and intestine. It is pinkish brown in color, soft in consistency, and is highly vascular. Now basically coming to the functions of liver, the liver is known to perform around 1500 functions in all. The minimum functions which I can note down here, I'm just discussing that: breakdown of alcohol and other medications. It controls around 500 metabolic processes which involve production of fat, proteins, and various glucose products. Reduces cholesterol, proteins, produces bile, regulates blood composition, processes nutrients. It destroys old RBCs, and it detox bodies by removing multiple toxins in the blood. Now, what is NAFLD? It is basically non-alcoholic fatty liver disease. Is a condition which makes more than 5% of the fat. It is not caused by alcohol use. If left untreated, it can progress to NASH, that is non-alcoholic steatohepatitis. Being overweight or obese, having type 2 diabetes or high cholesterol are associated risk factors for NAFLD. Prevalence of NAFLD: 1 out of 4 people have NAFLD, regardless of the weight. Males are more prone to develop NASH and fibrosis. In diabetics, more than 6 diabetes and 9 severe obese people out of 10 have NAFLD. Basically, progression of NAFLD is a healthy liver when there is excessive deposition of fat due to either diabetes or excessive weight. It leads to fatty liver, which later on progresses to NASH. It causes inflammation, which slowly progresses to liver fibrosis, later on leading to permanent liver damage called as cirrhosis. Now, coming to basic differences between NAFLD and NASH. So basically, only accumulation of fat in the liver without inflammation is called as NAFLD, that is non-alcoholic fatty liver. If inflammation is associated with the accumulation of fat, it is called as NASH. That is, it is basically steatohepatitis. Causes of NAFLD, which we have already discussed, are either obesity, food intake, excessive amount of junk food, genetic background, metabolic syndrome like patients having diabetes, excessive cholesterol levels, who are not maintaining their weight, lack of physical activity, and exposed to certain medications can predispose to having NAFLD. Obesity and fatty liver, basically, we have initially discussed this. Excessive amount of fat and lack of physical activity can lead to NAFLD, which progresses to NASH if not taken care and not detected early. There is threefold increased risk of death due to cirrhosis, and it is seen that diabetes and NAFLD are both goes hand in hand. NAFLD patients have high risk of diabetes, and diabetes patients have increased risk of NASH. Symptoms of NAFLD or NASH, initially NAFLD, that is, they will give you just NAFLD when there is no associated inflammation. There will be mild fatigue to the patient and right upper quadrant mild discomfort. But when it progresses to NASH, their symptoms will increase, and it will depend whether this patient is having cirrhosis or not. Okay. Diagnosis of NAFLD. The diagnosis of NAFLD often involves blood test, ultrasound, liver biopsy, and X-ray or CT scan, MRI. In blood test, most commonly seen is SGOT and SGPT. Generally, SGPT is more than SGOT in such patients, and it also indicates the amount, means the severity of disease. Next slide, please. Okay, so there are various blood tests which are available, which helps in scoring of NAFLD patients. These are FIB-4 score and the NAFLD fibrosis score. These scoring methods have been established to diagnose more better than AST and ALT alone. Online tools are available to calculate these scores. You can enter values from your blood report and generate the score to understand the risk. Non-invasive tests for NAFLD, these are easily available, economical, and basically sonography is done to detect the amount of fat in the liver. It only detects NAFLD. Fibrosis will detect NAFLD only if the fat is more than 25%, and it cannot differentiate between fat and fibrosis. There is another test which is available to diagnose of fat, that is fibroscan. It can detect fat which is more than 10%. It can differentiate between fibrosis and fat content. It is easy to operate, but reports can have positive reports can come in obese patients. Transient elastography, that is same, that is fibroscan. Liver scan works on the principle of transient elastography. We get two different values from this, that is LSM, liver stiffness measurement score, and this CAP score is controlled attenuation parameter, which helps in identifying the degree of steatosis. Non-invasive diagnosis of NAFLD, MRI elastography is known, and this MRI elastography is a very sensitive test, but the problem is that it is very costly. Mostly MRI elastography is done during liver transplantation for liver donor patients. Invasive test for liver to identify NASH is gold standard is liver biopsy. Liver biopsy can be helped to differentiate between NASH and NAFLD. It is painful, it is individual dependent, and sometimes there can be misdiagnosis in early stage of NAFLD. Now, progression takes years. NAFLD around 7 to 70% will remain either as a fatty liver disease, or it can progress to NASH. Around 20 to 25% will progress to NASH directly, and over a period of 15 years, this will get converted to NASH cirrhosis. Out of this, around 7% will progress to around HCC in 6.5 years, and around 19 to 40% will have decompensation of this NASH cirrhotic patients in 7 to 10 years. Next slide. So basically, the theme which we have discussed just now, that we have to act very fast and screen. So basically, NASH is not reversible, but NAFLD is reversible. So if we diagnose fatty liver early and follow lifestyle modifications, we can prevent liver from getting permanently damaged. Treatment is basically weight reduction, which involves diet, exercise, lifestyle modifications, and new medications. Control of weight gain is very important. Approximately, only weight reduction has been shown that it is a permanent cure for fatty liver. Approximately 7 to 10 kg of weight loss is required for any patient with fatty liver, and this helps to prevent further progression of NAFLD to NASH. Next. Weight loss has been shown more than 10% of the weight loss, around 70% weight loss. So this is basically a pyramid which shows the amount of fat reduced, amount of pathological resolution in patients with amount of weight reduction. Next slide. So diet is very simple, that we have to basically focus on, we have to avoid all kind of sugars, and we have to avoid all kind of fatty oily food. If we follow these two things, most of the food which is increasing our weight can be reduced, and it can help us to have a good life. Exercise, aerobic exercises are more preferred, and simple exercise which I prescribe to my patients is 45 minutes of walk daily. That is brisk walking, helps to reduce amount of fat in the liver and thereby preventing further progression. Lifestyle tips which I have told is develop an exercise routine and stick to it, get enough sleep, have enough vitamins and minerals, get regular medical checkup, eat small frequent meals, and lower your sugar intake. So there are multiple pharmacological treatments which have been advised by the NASL. These include pioglitazone, saroglitazar, and vitamin E. Saroglitazar is a very newly introduced drug, and it is very well established in the market, and it helps to reduce the amount of damage which is caused because of fat deposition in the liver. So basically, tips to prevent fatty liver is the same: reduce amount intake of sugars and trans fatty acids, eat balanced diet, reduce consumption of refined carbohydrates, maintain healthy weight, quit smoking, regular exercise, limit or avoid alcohol, take prescribed medicines as given by the doctor. Next slide, please.
Thank you, sir, for this wonderful talk. This has really enlightened us. Now we will take questions from our audience with your permission.
Yeah.
So, sir, the first question is, is NASH, sir, the first question is NASH age specific? Sir, am I audible?
Yes, you're audible.
Yeah, so the first question is there in the chat box. Is NASH age specific?
No, NASH is not age specific. The amount of fat deposited in your liver and the amount of inflammation will decide how early you develop NASH.
Okay. Sir, one more question is there in the chat box. How common is NASH and NAFLD in Indian perspective?
It is very common. It is very common with means almost if I see 10 patients in OPD, 8 out of 10 will have fatty liver. And all this is because of our lifestyle which we are following.
Okay. Thank you, sir, for your valuable feedback. Next question is, what are the risk factors for NASH?
Risk factors are basically excessive amount of weight gain, eating fatty oily food, excessive amount of alcohol intake, not taking medicines properly, not having a regular checkup, excessive weight, diabetes is there, high cholesterol, blood levels can all predispose to NASH.
Sir, next question is, can we get NASH without consuming alcohol?
Yes, because NASH is basically the same, no, non-alcoholic steatohepatitis. Alcohol, basically alcohol also leads to fat deposition. But the term NASH is associated only when the cause of this fat accumulation is not alcohol. But alcohol can predispose to the severity of NASH.
Okay, sir. Sir, now next question is, when to consult a specialist for NASH and NAFLD?
Basically, it is not like that. Means when to consult. It is see this year theme also which we have discussed is we have to act now. We have to screen fast. Every patient has to get a sonography done if the person individual thinks that my basic weight is in excess amount. We everyone have today's have access to Google and they can calculate their BMI. If their BMI is more than the prescribed numbers, then they have to get a sonography done. If the patient is diabetic, they have to get a sonography done. If they have more weight, they have to get a sonography done. Basically, sonography will detect the amount of means they will detect a fatty liver, and then we can further evaluate the patient whether he has NASH or not, and start treatment accordingly and prevent further progression.
Okay. Sir, next question is, which type of food to avoid in NASH?
Basically, we have to avoid all kind of sugars. Fatty, oily food should be avoided. Okay, and we have to avoid any alcohol intake.
Okay. And sir, last question is there in the chat box. Is fatty liver reversible?
Fatty liver is reversible if it has not progressed to cirrhosis.
Okay. Thank you so much, sir, for your valuable feedback and this lively and wonderful question answer session. So now questions are over. So on behalf of NASH 24/7, I thank Dr. Nikhil Patil sir for this lively and informative talk. As you have been emphasizing the awareness for the liver health and disease, it is equally important for the people affected by fatty liver to regularly visit doctors and continue medications. With careful observations and precautions, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with NEST 24/7 on Facebook and take care of yourself and your family members. Thank you all. Thank you, sir, once again with joining us on NEST 24/7.